Good morning, everyone, and welcome to today's jointly hosted webinar by myself, Samantha Manning of Searches UK. And today we're kindly joined by Rebecca Coates of PropertECO. Please can I double check that you can all hear me? If you can, please do let me know in the chat and the questions tab. Also, if during the webinar you have any questions or you would like to ask any further information, please do use the chat and the questions tab, and we'll be more than happy to answer any questions at the end of the webinar. Also, just to let you know, we did receive a couple of questions prior to the webinar going live. Some of these will be covered during today's presentation. However, what we will do is a Q&A session at the end, and we can also ask those questions. We will also provide our contact details at the end of the session. So if you have got any questions you'd like to ask on a one-to-one basis, do let us know. We will also be recording today's session, and a copy will be sent out of the recording after the session has ended. But for now, let me hand over to Rebecca, and thank you all very much for attending.
Thanks, Samantha. Good morning, everyone. Thank you for joining me to learn a bit more about radon this morning. And specifically, we're going to be talking about radon in commercial properties, whether that's workplaces or potentially landlord accommodation, buy-to-lets, things like that. I'm going to cover all of those bits, so hopefully you can advise your clients, know how much they need to know about radon, how much they need to worry about it or not worry about it, as the case may be. Just a very little bit about me. My name is Rebecca. I work for a company called PropertECO. I was one of the founders of PropertECO back in 2011, and I've also been the chair of the UK Radon Association last year. PropertECO is a national company. We just deal with radon. It's all we do. We do training and general advice consultancy. We offer radon testing, and then if anyone does have issues with radon in their buildings, we can design mitigation systems, install them and maintain them. So everything to do with radon we deal with. I've split today's presentation up into different sections. What is radon? Why should I care? How do I test for radon? How do I reduce high radon levels? What are the legal requirements for different stakeholder groups? And then how should you be advising clients in the conveyancing process? So I'm going to start right with the basics of what radon is, just so we're all clear. And we know what we're talking about, because there are sometimes some misconceptions with what radon actually is and where it comes from. So radon is a naturally occurring radioactive gas. It comes from the ground beneath us. It's present all over the world, in buildings in various concentrations, in the rocks deep beneath the soil. There's varying amounts of uranium naturally present that have been there since the Earth was formed. Uranium is a radioactive material, so it doesn't stay as uranium forever. It decays over a very long period of time. But when that uranium decays, particles become radium particles. Radium you may have come across in the past. It's a sort of solid silvery metal that used to be used in things like the aviation industry back in sort of World War II era. All the dials on aircraft, things that were fluorescent, they used radium paint because radium was fluorescent. You could see it in the dark, which was brilliant. But then people realized, oh, this is radioactive. It's not good for our health, so it's not used anymore. But you will, if you still go to museums and things, or old watch faces, if it's got fluorescent paint on and it's that sort of era, it's likely to have radium in it. Radium then naturally decays into radon, which is a gas. So uranium and radium are in the ground. They can't really move anywhere. Radon, though, is a gas, so it can move more readily through the soil, through the earth, and then up either into the fresh air outside or into a building. When it's outside in the open air, it dilutes to very low concentrations very quickly. It's not a problem. The problem is when it accumulates in buildings and then people are spending time in those buildings. The way it accumulates in buildings is an active process, and it's a process called advection, which is the movement of gas from a point of high pressure to a point of low pressure. Usually our buildings in the UK are in negative pressure, so gases will move from a point of high pressure to low pressure, take the least line of resistance. So any house or an office on a piece of ground is usually acting like a vacuum, and it will be drawing in gas from the ground. The greater that pressure difference is, the greater the rate at which the gas can come in, and there are varying levels of radon in different soils, which we're going to cover in a minute, around the country. So that process is what leads to high levels potentially accumulating in buildings. But there's no way to know how much radon is in your building unless you've done a test for it. You can't see radon, you can't smell it, and you can't taste it. There it is coming in. Where do we find radon? So radon is everywhere. I've already said it's found worldwide in various concentrations. The UK is not one of the countries in the world that has the highest natural levels of radiation. There's other parts of the world, other parts of Europe that have much higher natural levels of radiation, but we do have radon all across the UK. If you've looked at it in the past, you might have seen this map. This was the UK and Wales map published by the UK Health Security Agency, previously called Public Health England, which estimates the percentage of homes above a certain level likely to be above that level for radon. This was the map up until December last year, but what you might not know was that map was updated in December 2022. It's the first time it had been updated for England and Wales since 2007, so it was 15 years old. So there's a lot of new data now gone into the new map, which looks like this. So as you'll see, the colour coding has changed slightly. We don't have the yellows and the browns now. We've now got a range going from cream to dark brown. The darkest brown areas on the map are still the areas with the highest probability of finding a property with high levels of radon. The lightest colours are the lowest probability. One of the changes they did make to this map was that there's no longer, it's quite hard to tell on this, but there's no longer any white areas. They are now, the lightest colour is cream, to get over the misconception that white areas means no radon, or white areas means safe, or white area means there's no data. That's not what it means. It just means there's less probability. It's less than 1% risk. So the different bands are between less than 1% risk, which is classified as not a radon affected area, and then the lightest brown is 1 to 3% probability, and then it goes up 3 to 5, 5 to 10, 10 to 30, and greater than 30% probability of finding high levels of radon in a given address property. It's not definitive, it's just guidance on where you're most likely to find high levels of radon to guide you where it's most important to test. If I was buying a property or anything, I would test wherever it was, because that's the only way to know. But this gives you some guidance as to how likely it is to be an issue. So this is the new map since 2020. It's available online as a data set free of charge for people to use, where you put in your postcode online at ukradon.org. Got some of that in a second, I'll show you in a second. The free to search map gives you the worst case estimated for a 1 kilometre grid square. You can pay though for a more precise address specific risk, and that's the sort of data that feeds into the environmental reports and searches that are done, which I'll mention later on. But just if you finish this webinar today and you fancy going and checking your own house or your office for free, you can put your postcode in at ukradon.org, which is the UK Health Security Agency site. You just click on the map, show radon data, and it will tell you the probability that estimate that your property is affected by radon. So I just want to show you some of the differences between the old map and the new map, because there were some quite significant changes in various parts of the country. The old map unfortunately isn't available online, so I've only got screenshots from old presentations that I've done for areas, so I can actually compare like for like. But Leeds area is an area where there has been quite a lot of change. So here you can see on the old map, so this is pre-December last year, lots of the area around Leeds and West Yorkshire was a white area, so less than 1% risk, not classified as a radon affected area. You don't have to do anything. Whether you're a homeowner or employer, you wouldn't have to do anything here. This was the first level risk band, the light yellow, where it was 1 to 3% risk. The same postcode in the new map looks like this. So what was 1 to 3% risk is now 3 to 5% risk, as is some of this area, which previously was less than 1% risk, not designated as a radon affected area. It now is a radon affected area. And then some of the areas more over to the west here, they're now in the 5 to 10% risk area, so they've gone up a category. So the biggest implication is not where things have gone up a category, it's where they've gone from non-affected area to affected area, because that changes the advice on when you need to test. So it's really important that you're referring to the correct map, and that if you've advised people sort of just pre-December last year and it's still in a process maybe, that you recheck on the new map to check your advice is still accurate. So what's changed overall? How much of the country has changed based on that map? So just before the new map came out, a commercial client of ours, hospitality industry, asked us to check the risk status for about 850 of their premises all across the UK. We then reran that exercise based on the new map, and we found that 13% of those properties had moved into an affected area band. So previously they were in white areas on the map, less than 1% risk. Now they were at risk. So that's then changed the advice we give to those. 2% had come out. So they were in an affected area. Now they're not anymore. So they don't need to test those anymore unless they want to. 5% had increased the risk band. So they've gone up, 2% decreased, 78% there was no change. So still the majority will be the same as what they were. But it's that 13% of properties that if you hadn't checked the new map, it would be incorrect advice, and there could potentially be people at risk in those properties that, yeah, they wouldn't have known they needed to test. Other parts of the country where I know there has been those sorts of changes, Chester area in Cheshire, and some parts of the southeast, Canterbury area. I know places, some of areas around there, I've seen some quite significant change in the map. So if you're based or you have clients in those sorts of areas, it's well worth having a look at the new maps. So another note on where we find high levels of radon, more likely to find high levels of radon, is properties with basements. If we've got a basement, we've got up to maybe 5 times the surface area of in the property in contact with the ground through which the gas can be coming, because you've got walls and floor. And we've also usually got much lower pressure in basements, so you've got the ideal conditions for drawing radon in through any of those surfaces and then potentially trapping it there, going up to ground floor as well through the basement. So if you're dealing with a property with a basement, whether it's a workplace or a residential property, block of flats, anything like that, if it's got a basement, you should proceed as if it was in a radon affected area and be advising testing and further investigations, even if it's in one of those now cream areas, less than 1% risk. So the basement puts it at risk. If it's in an increased risk area anyway, and it's got a basement, then it's even more at risk, but it doesn't change what you need to do because you were going to advise testing anyway. Why does it matter if there's high levels of radon in your building? You can't see it, you can't smell it, you can't taste it, as I said. So does it matter if it's there and people are breathing it in? Unfortunately, yes, it does. I said before, it's a radioactive gas. We know that long-term exposure to radiation is not good for our bodies. As it's a gas, it attaches itself to little particles in the air, particles of dust and things. We breathe those in, we breathe those out. Some of them, though, end up potentially in our lungs, emitting radiation to our lung tissue. And that is unfortunately how tumours can be formed. Long-term exposure to elevated levels of radon is the second leading cause of lung cancer worldwide and in the UK. It's linked with over 1,100 deaths in the UK every year. That's the figure that the epidemiologists and the scientists are happy with saying. It's likely to be more than that, but it would never be on someone's death certificate, you died because of radon. It would just be you died because of lung cancer, and then you extrapolate what's the likely causes. If you weren't a smoker, hadn't been exposed to passive smoke, and the type of lung cancer it is, it might be likely that it's come from radon. And just exposure to radon in your home and in your workplace is the biggest radiation source that most people in the UK get. We're exposed to other bits of radiation every time we go on a plane, maybe if we have to have an x-ray, a dental x-ray, things like that. But day-to-day exposure to radon, even at low levels, accounts for most of our radiation dose that we get throughout our lifetimes. So how much is too much to be exposed to? There's something called the action level, and there's different action levels for residential properties and workplaces. And this is the point at which it's recommended, or in workplaces, it's required that you take action to limit exposure. So for homes, the action level is 200 becquerels as an annual average. In the UK, we measure radon in this unit called becquerels, which is expressed as becquerels per cubic metre of air. And just to put that in perspective, outside in the fresh air, the average level in the UK is about 4 becquerels, so it's not even 0 when you go outside usually. The average level in most UK homes is about 20 becquerels, maybe a little bit higher now, but so the action level is 10 times what the average is across the UK for homes, and that's advisory if it's your own owner-occupied home. You don't have to do anything, it's up to you if you want to. Since 2010, they've also had a target level, and again, this is guidance for residential property of half that level, so that's 100 becquerels. And the advice there is, if you're doing any remedial works, if you found high levels and you're doing remedial works, always aim to get to below 100. Don't just say, oh, we've got down to 199, great, job done. Always try to get to as low as you can, and ideally below 100. And the advice is that you strongly consider doing remedial works if your level's above 100, not just above 200, but particularly if you are in an increased risk group for lung cancer, and that's if you're a smoker or an ex-smoker. Because there is a synergistic effect between the lung damage that you get from cigarette smoking and from radiation and radon exposure. So if you've been a smoker ever, you are a smoker, you should always be looking at that 100 becquerel target level for your home. That does become the sort of grey area in conveyancing if people are looking at different levels and saying, oh, well, I want something to happen if it's above 200, and then someone on the other side might be saying, oh no, but I'm at risk, I want it to be 100. So I'll talk about that a little bit later when we talk about whose responsibility it is. For workplaces, the action level is 300 becquerels, and these are all as annual averages levels, because radon levels does fluctuate throughout the year, and I'll talk about that when I'm talking about testing. That is enforceable, and again, I'll mention that later. But those are the levels above which you should be doing something about radon. But what does that mean? Who knows what 200 becquerels of radon is doing in the air? Okay, it's radiation. What's that doing to our bodies? This hopefully will put it into perspective and just illustrate the level of radiation you might be getting and whether that's a good idea or not. So if you were to spend 8 hours per day on average in a building with 200 becquerels of radon, let's say that's your office, you would have the equivalent radiation dose in your lungs to if you'd had 112 chest x-rays that year. And that's just at the action level at 200 becquerels. I don't think many people want to go to hospital every 3 days and get another chest x-ray. I don't think any doctors would give it to you. But that's the level of radiation we could all be getting if you haven't tested a building without knowing it. And radon levels can go much higher than that. I've got a chart here. You'll get a copy of all the slides at the end. If you do any radon testing, you can work out roughly how many chest x-rays have we all been getting. This is all based on 8-hour exposures. So if we're working at home now a lot, and you're in your house for maybe 23 hours a day, or 20, yeah, and then at the weekends as well, you need to multiply these numbers because this is based on 8-hour exposures. Once you get above about 750 becquerels, it's a chest x-ray per person per 8-hour period, and that's you, your children. It affects pets as well, can do. And radon levels can go up much higher than that. The highest we've dealt with, we've had a residential property and a commercial property, different parts of the country, both with 16,000 becquerels. We frequently deal with levels in the thousands, the high hundreds, but predominantly we have a lot of clients coming with around the few hundred mark. Also, if you're a smoker and you want to think, what's the equivalent lung damage, for how many cigarettes can I cut out and offset it? If you smoked about 5.5 cigarettes in an 8-hour period, is the equivalent lung damage roughly to being exposed to 200 becquerels of radon. But if you're doing both, if you're smoking and getting that, then the lung damage is more than just that plus that, this extra synergistic effect there. So what's the biggest risk? We all know things about carbon monoxide poisoning. Most people now know, I should have a carbon monoxide alarm at home. You can find them in B&Q quite readily, or on Amazon, whatever. Landlords know they have to do a gas safety check, have the boiler inspected every year. But in the UK, every year, roughly I haven't looked at the figures in the last couple of years, but it's usually around about 40 deaths a year from carbon monoxide poisoning, which is 40 too many. We should be at 0, but statistically much likely to be affected by radon-induced lung cancer at over 1,000. The difference being radon-induced lung cancer is a long-term exposure and long latency period illness. It's not someone who dies tomorrow or next week and they in the local paper, their family, and it's long term, so it doesn't have that shock factor, and just the awareness isn't there yet, but it is increasing significantly. I was chatting with Samantha before we started the webinar and was saying we've year on year we've got busier and busier and busier, and particularly this year in the commercial sector, which I'm going to come on to shortly. So whose responsibility is it to do anything about radon? It's a natural gas, not my fault if it's in a building. It's always going to be there. It's always been there for thousands of years. Unfortunately, in most situations, you can't just blame it on nature. Someone has to take responsibility for it. And that might vary depending if you're a homeowner, if you're an employer, or if you are a landlord. Before I go through the legal bits of whose responsibility it is, because a lot of that is it's your responsibility to do a test, I'm going to explain how we do radon testing. So you may or may not have seen one of these. This is a radon detector. It's a passive detector, and this is the most cost-effective, cheapest, easiest, very reliable way of doing radon testing. So it's a small sort of dome-shaped piece of plastic. There's no flashing lights or buttons on it, no on-off switches. All it is there's a little highly sensitive piece of plastic inside there, little lens. There's small gaps around the back of the detector. You put it in the property for a period of time, you leave it there, air naturally passes through the detector. Any radiation in the air makes tiny little indentations, or we call them etches, on that lens inside. At the end of the test period, it's sent back to the lab. They take the lens out, put it under a very powerful microscope, and effectively they count the dots. More dots, the higher the level of radon it's been exposed to over that test period. That's a very simplistic explanation of a highly scientific process that they do with the analysis of those dots, but that's how it works. It's not expensive to do. We sell these detectors on our website. A pack of 2 detectors costs £33 plus VAT, which includes all of the laboratory analysis and the reporting at the end. So it's not, cost shouldn't be a reason why you don't do radon testing, and it's the only way to know how high the radon levels are in your building. I've got here that you can do a 3-month test or a 10-day test. So radon levels do fluctuate constantly. So the longer you test for, the more accurate your result will be in terms of what the annual average level is. A 3-month test is the standard test period that it's advised to do, and that's for homes or workplaces. We can offer a screening test in as little as 10 days. The longer you leave it after 10 days, the more accurate it is, but sometimes we have people who need to know something as soon as possible. So a 10-day test very much is a screening test, and it is just a snapshot of what the radon level was like in that 10-day period. There is a much bigger margin of error on that result when it's reported, but it can give you an indication as to whether it's likely to be a problem or not. But we would always recommend following up a 10-day test with a longer term test to confirm the results when you can. I said that radon levels are fluctuating constantly, and they do fluctuate considerably day to day, even hour to hour. I've got various digital monitors that show me the fluctuations. But generally over a year in the UK, with our weather how it is at the moment, we typically have about twice as high indoor radon levels in the middle of winter than we do in the summer months. It doesn't matter what time of year you do your test if you're doing a 3-month test, because we give you your actual level from that 3-month test period, and then there's a set of seasonal correction factors that we apply that are produced by the government that we apply to those test results to estimate then what your annual average level is. So if you test in the middle of winter, your actual result will be reported as higher than what we then say your annual average is. Test in the middle of summer, your annual average will be estimated to be a bit higher than your raw result in the summer. A note on doing the screening tests at this time of year, I would caution against relying on the result of a 10-day test in the summer months, June, July, August, simply because radon levels are naturally at their lowest anyway. People are ventilating more usually, not if the weather's like it is where I am today, pouring with rain and cold, But usually when the weather's warmer, people are ventilating more, there's less radon coming out of the ground, so you're likely to get a very low result in the summer on a 10-day test, which may not be indicative as longer term. If you do a 10-day test in the middle of winter, it's more likely to give you something reasonable like what it might be longer term. So if you're doing short-term testing for clients, just put that caveat in the summer months. It's a lot more unreliable than it would be in the winter. But it can still be worth doing as an indication rather than having no data at all. How many detectors do you need? Where do you place them? So if you're talking about a standard house, a domestic property, you would always use 2 detectors, 1 in a living room, 1 in a bedroom. That'd be 1 ground floor, 1 first floor, or if it's a bungalow or a flat, both on the same floor. We always test 2 locations in a residential property though. And you want to test the areas where people occupy the most, so usually a living room and a bedroom. But if you're working at home, that might be the office or the study or the kids' playroom, something like that. 2 detectors, leave them in place, don't move them around, then just stay in the same location for the full test period and then be posted back to the lab for analysis. There they are. If you've got a workplace, the number of detectors depends on the overall size and layout of the property. If you're testing sort of like an office block, it might be between about 1/3 and 1/2 of all ground floor rooms. We usually test a small proportion of first floor as well. If you've got basements, you need to test each individual room in the basement. If it's very large warehousing and things, it's less detectors per 100 meters square. But we can work that all out for you. Clients send me drawings of their buildings, say how many detectors do I need, and I can advise on that. Just putting that into practice, when we've done testing for some local authorities and they've got all different types of buildings they like us to test. So a little sort of village library might need 3 detectors. Fire station usually only needs about 2 because they've got big open areas with big roller doors. And then a smallish primary school might have about 14 detectors. Practical points, just so you know about radon testing, if clients are doing it, try and secure the detectors in the test location with a cable tie, ideally, so they don't go walkabout. They've all got a serial number on them. We need to know exactly where that serial number was in the building, the date that it went in, the date it came out, and they need to be posted back for analysis at the end of the test period. Don't go, if you've got someone testing a few different buildings, don't say, oh, I'll collect this one here, oh, and I can't go to that one till next week, so I'll keep these ones on my desk till I've got them and send them back together. No, it's better to send them into the lab as soon as possible once they've been removed from the test location. I mentioned earlier there are all sorts of digital monitors you can get now. Obviously this is a more expensive way of doing things, and you wouldn't want to have multiple ones of these in sort of every other room in a workplace, but they can be useful if you've done remedial works and you want to know, is that working long time, and certainly the ones where it gives you a graphical output can be useful to see any fluctuations, and whether that's, you know, you're having higher levels overnight and how much is it changing by the weather, things like that. So that's just an example of the sort of readout you can get from digital ones. So now moving on to the bit that will be of interest to you, and I will disclaimer, I am not a lawyer. I am not trained in this, so please do your own due diligence on what I'm saying as well here. But this is my advice to the best of my knowledge, what you need to do and what the requirements are. So homeowners, there is no legal requirement to test your own home. If you own your house, it's up to you if you want to know how much radon you've got or not. The only time that it does potentially become an issue is during conveyancing, when it does come up on the searches, the inquiries before contract, is it in a radon affected area? So that's when a potential buyer might raise the question. They might ask you to do a test, or it might then delay things if you haven't done a test. Some people might run away scared if it hasn't been tested, if they don't know that any property in the area is likely to say the same, it's in a radon affected area. So I would always advise, if you're putting your house on the market and it's in a radon affected area, do a test beforehand. You are then legally obliged to disclose the test results, but the probability always is that you're not going to have an issue, and then you've got that certificate that you can just head off any problems or concerns with straight away. Landlords, and this is residential landlords only I'm talking about at the moment. Landlords have to use the Housing Health and Safety Rating System, HHSRS. They have to follow that. This document is part of the Housing Act 2004. It has all sorts of different hazards listed in there, things like electrical faults, gas safeties, trips and slips and falls. And landlords have to check that their properties don't have any of these hazards in them. They're meant to sort of do a rating on them and give everything a score to see how likely it is. And the local authority can come out, environmental health can come out and assess against this. It's also got things like dampness in there, mould and condensation, which is a big thing, obviously, at the moment, has been over the last few months. Radon is also covered under here. There's a whole section on radiation. If radon levels are above 200 becquerels in a tenanted domestic property, it's classed as at least a band C hazard. Once it gets up to about 800, it's band A. Band A is the most serious sorts of hazards you can have in a domestic rented property. Bands A, B and C are called category 1 hazards, and the local authority, if they came and did an inspection, found any category 1 hazards, they would issue an improvement notice and expect that to be sorted pretty quickly. The guidance documents that sits behind HHSRS is where it explains that you need to do the testing. So first it says there's little if any need to consider radon as a hazard unless the dwelling's in an affected area. I would add in there, unless it has a basement. If it's a basement flat, yes, you do need to test it regardless of where it is. If it's in an affected area, so that's anywhere on the map that isn't cream, the only way to determine whether or not there's a threat to health is by measurement. So you've identified by looking at the map that there might be a hazard there. You now have to measure that hazard and either hopefully prove that it's not there in your property, or if it is, show that you're doing something about it. And you can't, even if you've got a client who's buying a row of terraces or a couple of semi-detached houses, you can't just test one and say, well, that one was okay, so the other one's okay. Each individual property can have completely different radon levels in, even if they're right next door to each other. And that's because we can't see what's going on in the geology underneath, and also how people use their buildings can affect with ventilation and heating. So each individual property does need to be tested. It also now is caught under the relatively new legislation, Homes Fitness for Human Habitation Act, which includes all of the 29 hazards in HHSRS as well. So just some more legislation there on why you need to be. Residential landlords need to be aware of radon, and they have a duty to test for it if in a radon affected area or have a basement. So as I said, if the levels are above 200, then you need to do mitigation work to reduce it. If it's between 100 and 199, so that's the target level, that sort of grey area, you can consider mitigation. You wouldn't necessarily have to do it. If you decide not to do it, you would have to evidence why you've decided not to, but you might want to consider doing it. Employers, if you're acting on behalf of someone who's buying a workplace building, what happens if they end up with radon in that building once they've bought it? It's under Health and Safety at Work Act. You have to ensure the health and safety of employees and other users in the building, and the Management of Health and Safety at Work regs. You have to assess any risks, health and safety risks that are there. What this means is every workplace should have a radon risk assessment. Everyone on this call today, I wonder whether your employers have done a radon risk assessment of wherever you work, and that might be from home, because it should be, if anyone's working from home, your employer should have included radon in their risk assessments for you working at home, as well as your desk height and your chair height and vision and all those things as well. But certainly, if you've got an office, have you done a radon risk assessment for your office? This is what a very basic view, what it should look like. I've looked at the map. Have we got a basement? Based on those factors, are we at risk of radon, or are we definitely not? So if you're in a less than 1% risk area and you don't have a basement, that can be the end of your risk assessment. You just say we're at low risk, we don't need to do any testing, we will review this in 2 years, 5 years, whatever it might be. If though you find, oh, we are in a radon affected area, or you've got a basement, you've identified you might have a hazard there, you therefore now need to measure that hazard to see how much people might be affected by it in your workplace. So you need to do testing. So radon testing is legally required in all below ground workplaces in the UK. So that's all workplaces with basements. And there is a caveat on there that are accessed for at least 52 hours or 50 hours a year, so it's about an hour a week. So even if it's, you know, a cleaner's cupboard or an archive store, if you've got people spending an hour a week down there, then it needs to be included in your risk assessment. And then all workplaces located in radon affected areas. So that's anywhere on the map that's not cream. So any shade of beige or brown now, you need to legally do a radon test if it's a workplace. If the levels come back less than 300 becquerels as an annual average, that's fine. You just record it, and it'll be recommended that you retest. You have to retest at least once every 10 years, more frequently depending how close to that 300 becquerel action level you are. So it might be once every other year or once every 5 years, depending what level you've got. If the levels are above 300 becquerels, though, then this legislation here, the Ionising Radiations Regulations 2017, IRR 17, comes into play, and that is now in force with your workplace. That's the same legislation that applies to, you know, if you think of things like nuclear power stations or people manufacturing some sort of radioactive weapons or whatever they radioactive chemicals, anything they might be doing. If you've got an office or a shop, school, any workplace where there's over 300 becquerels of radon, it's classified as a radioactive place of work, and that comes with certain red tape, certain steps that people have to take. What do you have to do? You have to appoint a radiation protection advisor. They will calculate doses and exposure based on the occupancy levels and the radon concentration. You have to restrict access. You either have to restrict access long term to what the RPA would deem as an acceptable amount of exposure people get, or best thing usually to do is to carry out some remedial works to reduce the radon level, retest to prove it's come down, and then you're okay to use the building as you want to. You also must inform your employees. Quickly going to go over how I reduce radon levels, just so you've got some knowledge. So if people are panicking about this, you can say, even if you find high radon levels, it's not a big deal to deal with. It does require someone who knows what they're doing to deal with it, because you can inadvertently make radon levels higher, but it's not major building work and it's not hugely disruptive. So the first thing we do if we find a property with high levels of radon is we always go and do a design survey. Sometimes we will use this equipment, which is a grab sampler, to take a very quick, it's a 6-minute radon sample, which will just help us fill in the blanks from the long-term testing and compare levels. We would never use this to say whether you've got a radon problem or not in your building, because we could get a completely different result now to if we come back later on in the afternoon. But it allows us to build a picture, a pattern, so we can see where the hotspots are potentially, or whether it's broadly the same over the whole building. And then we would design either a radon sump system or a positive pressure system, depending on the radon levels, depending on the size of the room and the space that we're trying to deal with. So a sump, and these are both to do with changing that pressure difference between the building and the ground. So a sump system is a way of creating a point of negative pressure under the building to which the gas is then attracted. So from outside, almost always from outside, we drill under the building, create a very small void, that becomes the area of low pressure, that's called the sump. The gas is automatically drawn towards that rather than into the building. And then we install some pipe work, which just looks like drain pipe with a fan in the middle that the pipe work passes through to exhaust the gas from that sump and safely vent it well away from any doors or windows. So it usually goes above the roof line. This is what it looks like when we come and do our work. So the time and the cost depends largely on what we have to dig out to get under the building from outside. So is it a flower bed? Is it tarmac? Is it lifting paving stones? Those sorts of things. Use diamond drilling to core drill this sump out, and then install the pipe work. Pipe work goes up, and then you have this sort of thing. So it's not hugely obtrusive on the building. Usually we try and put it on the back of people's houses. You wouldn't particularly want it right by the front door, but they're fairly neat systems now. The fans we use, we import from the US because they're the best radon fans you can get, and they're the smallest, they're the quietest, and the most efficient. They come in black or white, so they look fairly neat once they are installed. It's not like you've got some massive machinery or sort of any radiation warning things on your building. That's all it is. It's not going to draw too much attention to it. If you've got a commercial building, you might need more than one sump. So this was a large call centre, this one. They needed multiple sumps, and here we had to put the fans higher up just to prevent any vandalism issues. Very occasionally we have to do an internal sump, so rather than coming from outside, we have to go through the floor and create the void and then put the floor back together. This does not happen very often. I don't think we've ever done it in the years I've been working with PropertECO. Never done it in a residential property, and a handful of commercial buildings where it's just not viable to get from the outside. They're really effective systems and can reduce your levels considerably. Positive pressure systems is another way of dealing with radon, and this works by very slightly increasing the air pressure in the building. So the gases, you inhibit that rate of advection of the gas being drawn in, and it gives you regular air exchange in the building, so you dilute anything that is coming in as well. These sorts of systems are really good, and they're really commonly used actually also for condensation and mold issues. So they help with that. So a lot of social housing uses these for those anyway. They need to be calibrated slightly different for radon, just to make sure they're running at the correct rate all the time. But it's usually a unit goes in the loft, or you can have wall mounted units if it's a flat roof building or a commercial building. They draw extra air in, filter it slightly, can warm it slightly, and then diffuse it out through the building. That's the sort of thing you might see in an apartment or in a workplace, a small office. We've got larger industrial ones that if you need more airflow or a further distance of pipe run to go through, we have things like that. So that's very quickly how we deal with high levels of radon. Now, what do you need to know about radon? When you're in the conveyancing process, you're advising clients, it's all very well and good knowing that. What information do you have to pass on? What's the best advice you can give your clients? So firstly, you will, in the commercial contract, it will come up radon under, you'll be asked to supply environmental reports to get. You will, under Con 29, which I believe still applies with commercial properties, you'll be asked the question, is it in a radon affected area? And then you'll have to provide the answer. Yes, it's in a 1 to 3% area. Yes, it's in a 10% to 30% area, or no, less than 1% area. Remember to also always check if it's got a basement or cellar. Advise them that that puts it at higher risk, because often that is missed and surveyors forget that bit, and it doesn't then get acted upon. You'll do your environmental searches, of which there's a range available. I know Searches UK provide all these different ones where radon will be mentioned. There will be a small amount of guidance in there. If it says radon's been identified and it's in a 3 to 5% risk area or whatever it might be, it might then give you a link to UK HSA website, ukradon.org, to get more information. And yeah, it will probably recommend to do testing. That's what I would recommend, testing. It's when you do the testing, because some people, you don't want to wait 3 months to complete. You want to get on and buy this building for whatever you want to use it for. So the option is you do the screening test with the 10-day detectors or with a digital monitor. But as I said, it is just a snapshot. This is actually a digital monitor that I've got at home. Here's a snapshot. This was in a summer month. This was last year. You can see my average was really low in my house, luckily, was about 12 becquerels. But within that week period, I had some days where I was up closer to 30. So depending what week you test, if your levels are higher than this, that variation could be more considerable. So just remember that a screening test is just a snapshot, particularly at this time of year. The best thing to do to be certain and to cover yourself if you're acting for the buyer is to organise a retention or a radon bond to allow for a full 3-month test to be carried out on completion. So you're not rushing it, you have the full amount of data, a 3-month test. It will also be tested under the new occupants' occupation habits, so how they are heating and ventilating and using the building. It's not advised to test buildings when they're vacant, because you will get potentially a different result because it's not being ventilated or heated. So if you do that, organise the retention, agree a sum of money to be held pending the results of the 3-month test. If the 3-month test results come back all low, that's fine, money can be released to the vendor. If they come back above the action level and you have to agree which action level you're talking about, then that money is used towards the remedial work. Any leftover gets passed back to the vendor. If the work ends up costing more than the amount that's been agreed in the bond, the purchaser has to pay the additional amount. So the queries here are how much do you keep back, what's the time limit, and what's the trigger level. So it's really hard to advise on commercial properties because they're all so different sizes. But if you think about for an average domestic property, we recommend to clients that they ask for £2,500 in the radon bond. Unfortunately, radon works do attract VAT. So for domestic clients, they have to take that into consideration in their total costs. A single sump on a residential property usually these days costs around about £2,000, thereabouts, depending where it is, depending how high the exhaust has to be and what we're drilling through. That's the sort of figure that it costs to put in a sump system. If you've got a commercial property with much bigger footprint, you might need to allow for the potential for needing multiple systems on a building. Positive pressure systems are similar costs these days usually. Again, depends if it's going in a loft, depends where the electrics are, depends what size unit you need, those sorts of things. But that's a ballpark figure that gives you a starting point. And obviously it is a negotiation. A vendor doesn't have to agree to put anything in the bond. It's a negotiation point. The time limit, we would always recommend a minimum of 6 months, or 6 months as a suitable time limit from completion, and that leaves time for the purchaser to acquire the property, move in, do any small redecoration or anything they want to do first, order the tests, do their 3-month test, get the results back, and then potentially get a survey to get then a quote for the works that then they can present to the vendor or their solicitors to say this is how much it's going to cost. We have some people who say, oh, I've just finished my 3-month test, the bond time period runs out next week because they only allowed 3 months for it, which then makes things very difficult. So try and allow as long as possible. 6 months is ideal. And then you've got to agree the trigger level that it's going to be. So if you've got someone who's buying, a landlord who's buying some buy-to-lets, they might want to say the trigger level is going to be either 100 or 200 becquerels, because it's above the domestic action level that they will have to take action because their tenants, clients are going to be residential. If it's someone who's buying a commercial property, then it's likely that the trigger point would be 300 becquerels. So above 300, then the bond money comes into play. What if, very quickly, I know we're running out of time, want to leave time for questions. What if the property is a new build? You cannot test plots of ground for radon. There are some, well, you can, there are some companies that do it and put detectors down in little tubes and borehole things. It's kind of meaningless, that result. You'll probably always find something. The question is though, from this advection process, how much ends up in the property? There's other man-made gases where you can test for it, and if it's there, that's a problem. You'd be hoping to not find any of it on sort of, you know, plumes from landfill gas. That's what that sort of technique is really for sort of eliminating that there's any there. For radon, you're probably going to find something. It's not going to tell you how much is going to end up in the building. So new buildings under the building regs, this again has just been revised in the last month. The building regs points you towards this, which is a BRE report, BR211. BR211 has been, the first version came out in 91, 92. So any building built pre then probably won't have any radon protection in at all. And then any buildings built since then, it will depend on what this document said at that time and what the maps were showing for which areas needed to do which thing. There's different levels of radon protection that are needed depending on which band, affected area band you are. There used to be a set of maps in BR211. This latest one now refers you just to the UK Health Security Agency map, and you then have to extrapolate that data for when you have to do something for new builds. You would think, so the 3 levels of protection you can put in a building, in a new build, as required under BR211, is no protection, so nothing at all special for radon, basic protection, which is a membrane system, and full protection, which is a membrane and then facility for some sort of active ventilation if needed. You would think that it would be easy, oh, no protection for less than 1% risk, which is the non-affected area, and then the others for the 1 to 3% upwards. Unfortunately, no. In England, the building regulations say that you don't need to put any radon protection in a new building until it's in the 3 to 5% risk category or higher. So you can have a load of people building properties, homes or offices in 1 to 3% risk areas of the country. They look at the guidance, they, oh, don't have to do anything for radon here. But the first purchaser, your client, is buying this as a buy-to-let or as a workplace. So as soon as they take delivery of that building, they have a duty of care, to legal obligation to carry out a test, do their risk assessment, and there's a chance that they might find high levels of radon. I mean, there's a chance in the less than 1% areas you might find high levels of radon, but this is a known area, classified as a radon affected area, where under the building regs in England and Wales don't have to do any protection. In Scotland it's different. In Scotland you do need to install radon protection once it gets to 1 to 3% risk. So the England, Wales, I'm afraid Northern Ireland, I'm not sure on the latest guidance what it is, but I can find out if anyone needs to know. So do put a question if you do need to know that at the end. And then the other categories: basic radon protection in 3 to 5% risk, full protection in then the higher risk bands. What does that look like? This is basic radon protection. It's a gas-proof barrier, needs to be perfect if it's going to work. Anything like this, you might get away with that if it's a damp-proof membrane. It won't work for radon. Quick bit of science lesson: next time you have a takeaway coffee, look at the lid. You have a big hole for liquid to come out when you drink your coffee. There are 1 or 2 tiny pinpricks on there for compensating air, and that's to stop the cup depressurizing. When you take the liquid out, the same amount of air volume goes in through those holes when you remove the liquid. So big hole, liquid, small tiny holes for air. So that's how perfect a gas barrier has to be, compared to be waterproof or damp proof to be gas proof. And if it needs full protection, you either have to have a suspended floor, so you could ventilate this with either extraction or forced air in the future if necessary, that void, as well as the membrane underneath, or you put in a series of sump boxes, so that's just formwork to create the voids, cap them off, ready to be used if necessary. But nobody ever tests in a new build. People think, oh, I bought a new build, it must be up to standards, brand new, it's not going to have a problem with radon with it. Yes, you are still meant to test to find out whether you need to use these things. So I've whizzed through the last bit there. Hopefully I've covered what radon is, why you should care and why your clients should care, how you can test for radon, what the legal obligations are for different stakeholders depending on what they're using the building for, how you can reduce high radon levels, and most importantly, why it's really important that you advise clients at pre-purchase stage all about radon and the implications it might have for how they use their building going forward. So apologies for rushing at the end there. I wanted to leave time for a few questions. Does anyone have anything? Samantha, over to you.
We do actually. So one of our clients has asked, what is the risks of buying commercial properties?
Okay, so obviously there's lots of different risks in buying commercial properties, but specifically radon, as I've said, it depends what you're going to use the building for. The risk is that if it's going to be a workplace, your client has to do a risk assessment. That risk assessment includes testing. At that stage, they might discover they've got high levels of radon. They might then, the worst case scenario is they're told you cannot use this building to work in, or your employees can only use that office for an hour a day if it's got very high radon levels, something like that. So the risk is that you end up with a building that you are restricted on how you can use, and that is enforced by HSE. Health and Safety Executive are at the moment incredibly active on radon. They're mainly working in the education sector at the moment. We've worked with hundreds of schools this year because HSE have been turning up on their doorstep saying, where's your radon risk? But they may well move into private sector and other things soon. So yeah, it's a financial risk based on not being able to use the building as you intended to. And also there's the health risk for you if you're planning on working in there, and your staff as well. So there's a sort of moral obligation to know about it.
Brilliant. Okay. And to what extent do solicitors need to report on radon?
So you are obliged to carry out the searches, and really you just have to do that statement that comes in the state, oh, it's in a 1 to 3% risk area, or it's in a 3 to 5% risk area. That's what you're obliged to do. A lot of people at that stage, they've never heard of radon, so they might then just go off Googling radon. That's when I get phone calls from people saying, I've just had my search. So many solicitors don't provide any information more than, oh, you're in a risk area. Mm-hmm. Might then say you should consider testing. Now you all know a little bit more about radon. You might like to advise your clients, if you see it flagged up in any reports that they are in a risk area, highlight it to them, say this is really important. Don't just gloss over it. So
perfect, brilliant, thank you.
Okay.
Well, we haven't had any further live questions. We've had a couple of people ask for the link to to purchase the 3-month radon test kit, but what I'll do,
Okay.
Rebecca, I'll send you those details after the session has ended, if that's okay for you to then go back to those individuals.
Yeah, happy to, of course. Yeah.
Brilliant, thank you. So thank you so much, Rebecca, for hosting today's webinar. We would like to also thank all of our attendees for joining today. We appreciate how busy you are at the moment, so thank you for taking time out of your day to spend with us. All that's left to say is thank you all so much for attending again. Have a lovely day, and we'll see you again soon. Take care. Bye.
Right.